Thanks so much for joining us for this webinar, which focuses on urgent issues at a time when discussing the immigration system and immigration detention, I think takes on particularly additional significance in the midst of serious protests all across the United States and the world in relation to racial justice, policing, and issues that are very much at the heart of the movement to address the harms of immigration enforcement and immigration detention in this country. And I think it's a solemn moment to be talking about some of the most complicated aspects of this, which are the issues of health and the right to health in the midst of a global pandemic. So I wanted to just begin the webinar very briefly, and then my colleague Catherine at Physicians for Human Rights will say a few words of introduction as well, by situating this webinar and this discussion about health and issues related to health and detention in a system of detention that's a really sprawling and complex one. We'll hear more about this throughout all of the presentations, I imagine, but for those who are new to these issues and are joining this webinar to understand them for the first time, we have a system of immigration detention in the United States that stretches across a number of federal agencies and intersects with various state and local detention facilities. The primary detaining agency in the United States is Immigration and Customs Enforcement, or ICE. They currently hold about just under 26,000 individuals in their custody and care, but by and large, they don't do that at their own facilities. They do that in facilities all across the country, often local jails and prisons, frequently private detention settings. There are scores of individual detention settings across the United States where ICE is holding these detainees. And then in addition to ICE, we have individuals detained in the custody and care of the Office of Refugee Resettlement, again, often through contracts and relationships with other detention settings, the U.S. Marshals Service, which detains those who are being prosecuted by the United States, frequently for offenses that are just linked to their immigration status. And not for any other reason. And then the Bureau of Prisons holds immigrants who are convicted of those or other offenses in specialized facilities. So, across this sprawling detention archipelago, there are tens of thousands of migrants in detention at any given time. For the statistics for this sort of introduction of just under 26,000, that really only addresses a part of that overall detention system, but it is useful perhaps to illustrate what an inadequate response the government has made. That the ICE notes that they've released only about 900 immigrants in sort of the post pandemic or during the pandemic, and have released only under 400 as the result of court orders. So, this is a situation where we have tens of thousands of people in detention. Those numbers have not been reduced because of releases. And so today we'll hear both about some of the medical issues as well as the efforts to address those issues. And now I'll turn it over for a few more words of introduction to my colleague Catherine at Physicians for Human Rights.
Thank you so much, Ian. That's a really helpful overview, talking about the different types of custody that family members or friends might find themselves under. And I'll just mention, Ian already mentioned to us that there have been just under 400 judicial releases, and that includes people who were released as a result of the litigation efforts of our colleagues who will be speaking on the second half of this webinar. But I just want to highlight a resource for you. For advocates, you'll be familiar with this, but for any friends or family, if you go to ice.gov/coronavirus, you can get all of the publicly released ICE statistics. So for example, today that includes 3,113 detainees have been tested as of yesterday. The total detained population is 25,421. and there are 818 positive cases that ICE has publicly disclosed. So if you want information about the current ICE numbers, and it also mentions facilities where people who are in detention have to, oh, thank you, Dr. Lopez has shared that in the chat as well, that link. So that's a helpful link. We are concerned that ICE is not releasing all of the numbers. There's a really good blog post out by Vera Institute of Justice today that says, listen, ICE hasn't confirmed how many people have tested negative. So some of those cases are still pending. There could be more people who were still waiting for their test results. So we don't know the full positive test rate, and that's concerning for us, but I think it's important for us to take advantage of the numbers that we do have and use those to have information about friends and family, the detention center they might be in, and also for advocacy. So I'd just like to mention that Cornell Law School, Cornell Medical School, and Physicians for Human Rights have been collaborating on providing forensic evaluations for asylum seekers for many years, and since the pandemic started, also providing some expert declarations for lawsuits, trying to educate judges about the risks that people can face due to the spread of the coronavirus in detention settings. And so at Physicians for Human Rights in Cornell, we were discussing back and forth what might be helpful, and we just really felt that it was critical for us to provide up-to-date scientific and medical information as well as legal information in a way that would be accessible for families, friends, and community advocates. So you are our audience, and we hope that this information will be really useful for you. And now I will turn it over to Gabriela, who will tell us about the Q&A feature of the chat.
Hello, thank you, Catherine, for that introduction. My name is Gabriela Pico. I'm a student at Cornell Law School, and basically I will be helping to moderate the chat, so there will be a couple pauses during the presentation where we're going to go over the Q&A, and I'll be monitoring the Q&A, and if I see any questions that really haven't been answered and are in line with what's being presented, I will bring those up in the Q&A. I also wanted to mention, if anybody feels uncomfortable asking a question in English, I'm bilingual, so if you prefer to ask your questions in Spanish, I can translate those to English to our panelists. Thank you.
All right, should we move on to the introduction of the first panel then?
Great.
Okay, great. Good afternoon, everybody, and thanks for making the time to join us this afternoon. My name is Basil Saffy, and I'm the Executive Director for Cornell's Office of Engagement Initiatives. My hope is that today's panels will lead to new and powerful opportunities for partnerships that combine both the content and context expertise needed to engage community partners, advocates, faculty, and students in this important initiative. The first part of today's webinar is specifically designed to allow these prominent public health and medical experts, Ranit, Alan, and William, to provide an overview of COVID-19 and its relation to detention and safe medical release. So welcome everybody, especially the speakers. Dr. Ranit Mishori is a senior medical advisor for Physicians for Human Rights and a professor of family medicine at the Georgetown University School of Medicine. Dr. Mishori has been a champion of immigrant health for the past 2 decades through intensive engagement in various activities, including clinical care for refugees and asylum seekers, documentation of human rights violations, education, and scholarship on these issues as well. Dr. Alan Shapiro is the Senior Medical Director of Community Pediatric Programs and Assistant Clinical Professor of Pediatrics at the Albert Einstein College of Medicine. Dr. Shapiro is on the Executive Committee of the American Academy of Pediatrics Council on the Immigrant Child and Family Health, and has co-authored the Academy's policy statement on detention of immigrant children, in addition to many other related publications. Finally, Dr. William Lopez is a clinical assistant professor at the University of Michigan School of Public Health and author of the book, Separated, Family and Community in the Aftermath of an Immigration Raid. We're delighted to have the 3 of you here today and want to start with an initial question. Quite simply, what is the basic health information about COVID-19 and detention that families and those in detention should know?
I can take that question. I think families need to know that their loved ones in detention are at a higher risk for two things. One is for getting the disease itself, being exposed to it because of the setting itself and how the disease transmits in congregate setting, but also to know that certain profiles, medical profiles of their family members and loved ones may dispose them or predispose them to having more severe disease if and when they get it. So these are two very important aspects. One is how quickly it can spread in that setting and what the impact might be on the individual.
Thank you. Alan or William?
I think since nobody's talking, I can add that you know, the medical facilities at those settings is important, and whether they're prepared to take care of potentially a large outbreak and in a disease, in the context of a disease that when some people get it can very quickly deteriorate into something that requires intensive care. So from my understanding of the and experience with the ICE detention facilities in general and immigration detention, those the resources are generally not there in terms of the ability of the medical team in the facilities to take care of people.
Great. Alan, please go ahead.
Sure, I could add a little bit to that. This is Alan. So I think a couple of things are really important to consider, and maybe some of this we can go into a little bit later, but you know, the first thing I always think about when we talk about family detention centers and children in detention is the trauma that preceded their detention and how vulnerable that makes them, especially at a time where everyone is so afraid. And so the impact on their mental health and their development, which is so critical for children, especially children who are spending long periods of time in detention, are so worrisome. And we could talk about some of those issues maybe later on, but more specifically to COVID, a couple of things I like to add to Ranit's points are that many of the families that we see in our program, Terra Firma, which is a program that is based in a community health center, and works with released families and unaccompanied children, is that many don't know their own medical histories because they really have lacked access to health care in their countries of origin. And so we find many patients who don't know that they have hypertension, might not know that they have type 2 diabetes, things that really put them at risk for severe COVID infection. So being in the detention center, like Ranit mentioned, and putting them at such higher risk for contracting the infection. Also, there's this added aspect of them not even knowing that they're at higher risk because they don't know their health care. They don't know their own health care profile in some cases. Then I'll just add, in terms of the risk that children have and the difficulties in maintaining the ability to prevent spread in the infection in detention centers that have children really are not even addressed by the CDC in their own detention guidelines. So when we look at the detention guidelines by the CDC, there's nothing written about children. And we know that children can't socially distance themselves. We know that they can't maintain wearing masks. We know that they mouth objects. And so they're really at a high risk of spreading infection. And just lastly, that we know that those children, children with no underlying infections have been the ones that have been most at risk for that very severe infection that some children get called multi-system inflammatory syndrome. So I'll leave it at that.
Yeah. Thank you very much, and bienvenidos a todos. My name is William Lopez. So most of my work in public health looks at the way immigration enforcement impacts families and communities, and one aspect of this is certainly detention. What I want to talk about mostly today, I do a lot of organizing as well, and I look forward to speaking with the folks who are also doing organizing so that we can think about how COVID is impacting us specifically in physical and biological ways, but also what are the social impacts it has and what can we do to work together, especially across disciplines, public health, medicine, organizing, etc. I'll speak up a little bit better. Thanks, Irene. So one of the things I think this has made us realize here is that there are many ways we study in public health to stay healthy. And one of them is social support, right? So we've been working with people who are detained and for all the reasons that were just mentioned, feel incredibly lonely, scared, and isolated, right? Appropriately so. And what we've tried to do is find ways to lessen that isolation. So for organizers, you know, what we've been doing is we had a letter writing campaign to get letters to folks who were inside, and we also found ways to put money on folks' commissary accounts so that they're able to speak to folks on the outside. What this has forced us to do is step outside of what we learned to focus on as disciplines and think more about how we can look at health from a broader perspective socially. And I look forward to the rest of the event talking about what we can do and the other social elements that end up impacting our health, especially in a time of COVID, and especially as undocumented or mixed status communities.
Great, thank you. Thank you, all three of you. We have a minute or two for a couple of questions before we move on. Do we have any one or two questions that we'd like to pose to the panelists before moving on?
Hi, Basil. I did see in the preliminary report Q&A, somebody asked, what is the incidence of children in detention contracting the virus? And are these children transferred to a medical facility or are they treated on site?
Any of our panelists care to answer that?
I think, Alan, you should take that. If not, I'm happy to take it.
Well, and Ranit, maybe you could talk about the incidents, but I think the thing that we worry most about is the responsiveness and the accessibility of healthcare services in the detention center, in the detention system. So that what we have seen in the past is that when parents present with their children with symptoms, they're not always taken that seriously. And sometimes that leads to more serious illness, which we have seen tragically over the last year and a half, with about 7 children dying in detention, not COVID related, but other viral like illnesses that have led to unfortunate outcomes. And so the other aspect is that in the 3 detention centers, which I visited all of for children, for families, there's no pediatrics, there's no pediatric specialists in these facilities. And we know that children are not little adults, and children have their own special healthcare needs and present in very special ways, so that it is concerning. It's very concerning to me and my fellow pediatricians that children are kept in detention because they really do not have access to the care that they need. And that goes, that would really pertain to the pandemic as well. Ranit, maybe you could just add a little bit to that.
Yeah, I want to add 2 things to this. One is to kind of follow up on children are not young, little adults, is that children present very differently. And what we know or knew of COVID for a long time, people generally thought of it as an infectious disease that affects the breathing or the lungs, the respiratory system. But we know that, number one, this is not what it is at the moment. It's much more of a multi-system disease, and that it presents completely differently in children. So in children, for example, if you're looking for the fever and the shortness of breath and the cough, that's not going to be the case. And in kids, sometimes it presents as a diarrhea or certain skin conditions, or not at all. So that is number one. And number 2 is because kids are not little adults and they present differently, they're not going to get tested because they don't have the classic symptoms. And we also know that testing in general around the country, and especially in places of detention, has been done miserably with shortages of all kinds of materials that are required for testing. So the bottom line is we don't know what the incidence is. I doubt that we will ever know what the true incidence is or the prevalence. And it's based on a combination of factors.
Great. Thank you to you both for that. I know we have another question from Stan that I wanted to ask if you'd wait a few minutes, because we will be getting to that particular question about the transfers. But with that, Catherine, perhaps we can move on to some of the resources that are available for friends, family, and community sponsors of people in detention.
Yes, thank you so much, Basil. And I just want to take a moment for people in the webinar to kind of check in whether you're a community advocate or a friend or family member. You know, it can be very discouraging and hard to hear that actually, you know, the risks in detention or other types of federal custody are quite high. And, you know, it's basically not a situation that you can easily mitigate the risk to your, you know, to your family or friends. So I think that reminds us how important it is for people to be released, and that's really our shared commitment, and that is possible. And we are seeing hundreds of people being released. And so that's really the goal that we need to press forward with. And with that being said, I will just paste into the chat this resource, which will be translated into Spanish very soon. But it was developed between Freedom for Immigrants, Women's Refugee Commission, and Physicians for Human Rights, including Dr. Mishori, and it has guidelines on safe release. So if your friend or family member or, you know, someone that you're sponsoring is about to be released and you're wondering, how do I organize transportation? What do I need to do if I'm preparing the accommodation for this person? This document has very practical advice for, you know, supplies and steps that you need to take. So I'll, since Dr. Mishori developed this document, I'll ask Dr. Mishori to share with us some of the top, maybe the top 3 takeaways that you would tell to friends and family from this document.
Thank you, Catherine. I think that one of the reasons we developed it is because throughout some of the medical legal partnerships and the emergency litigation that we've been involved with, we've seen that both lawyers and sometimes ICE were saying, well, you know, is there safer? People are safer in the jail or in the detention center, which is completely it's a complete fallacy, of course, because of some of the reasons we discussed. So the question is, people are safer on the outside with their families and with their communities. So what do people need to know? What their communities need to know to facilitate this the release in a safe way? And I also saw the question about transferring people between facilities. That's the same idea as transferring them from a facility to the community. Without going into too many details, and you can look at the document, 4 issues that are important. One is, where are people going to go, especially if they have symptoms or if they've had symptoms or even if they tested positive, where are they going to go, and what kind of setup needs to happen to facilitate either isolation or quarantine. And most people need to leave and go into a 14-day quarantine. How do we coordinate with community-based organizations, especially with the healthcare system and with the Department of Health if needed? This is critically important to facilitate the provision of all kinds of community-based resources, from housing to medicine to food, etc. And then the bulk of it is, how do you protect the person who is receiving the detainee and the detainee themselves as they leave? So talking very, very practically about, what do you need to have in your car? How do you set up your car in a way that it prevents the transmission within the car? And how do you clean up, and what kind of masks and goggles and things that do you need to provide to the person as you're receiving them outside or after release? So it's very, very kind of hands-on and very practical, and I hope people can use it. And as Catherine was saying, it's going to be translated into Spanish very soon, so hopefully people and families can use that easily, and it's accessible to all through the internet.
Yes, and it covers different situations, as Dr. Mishori said. So people who've tested positive, people who haven't been tested, people who've been exposed, people who haven't been exposed. Can you pick them up from the facility? Do they need to take a bus? Do they need to take a plane? So these different scenarios are covered. I think just one more question, Dr. Mishori, and then I'll hand it over to Basil. But Ranit, how would you recommend that family or friends use this resource?
I think it's good to prepare ahead of time and know what to look for, know what the risks are. We talk about designating one person, so in order to minimize exposure to multiple people. And we recognize that this is a potentially very joyous moment for people anticipating the release of their loved one, but there needs to be they need to do that with a lot of caution and pre-planning. So it needs to be deliberate in order to minimize the risk to the family, to the detainee, the former detainee, and to the community.
But I do worry a little bit about this kind of like the school has to fix that.
Somebody needs to mute themselves.
Okay. Lovely, lovely. Appreciate that. Now, moving on, particularly for Bill and Alan, over the last several months, we've been working the amicus briefs, which you'll learn more about in the next half hour or so. But information change daily. New publications as COVID-19 is researched more heavily. There are new tools that are being developed every day. So when you take a look at this resource, what aspects appear to you as being missing that we as a public health, medical, and advocacy community can help contribute to?
Alan, I'm happy to go first. You want to go?
Sure. Go ahead.
Yeah.
Go ahead, William.
Thanks. So I think this is a fantastic resource. I was reviewing it before the session, so thank Dr. Mishori and everybody who put it together. Thank you so much. I'll share a story about my own family and how we've kind of coped with COVID here in Michigan. So my parents live about a mile away. They moved. My mom's from Mexico. We've lived in Texas my whole life, and I've lived here 10 years, and my parents finally came up here. So my parents are very excited to see I think the one who needs to mute, I think it's my partner in the background who's also on a call and also working. So I apologize about that. It's the challenge of sharing home offices, but I'll try to scoot up and be a little more aware. So I'm aware. Thank you. Thanks, Patrick. And so, we were telling my mother is happy to see her grandkids. And, I was as a public health professional making videos, making them in Spanish for my community and telling about 6 feet, wash your hands, things we know very well. And as I talked to my mother and she's looking at her grandkids, she always manages to put it in perspective. And she's like, well, the hardest thing is not being able to hug them anymore, right? And so what I found myself doing and trying to understand is some of the opportunities that this disease has to spread are because our normal gestures, perhaps they're cultural, perhaps they're familial, our normal gestures of love, we now aren't able to do, right? So we're not able to hug. For some of us, we're not able to shake hands. My parents can't drive my kids around in the same car because we're trying to distance. And I think what's so beautiful about this document is that we're able to say that we understand having the quinceañera with a lot of people in the room. This is how we show our love. But this is also how we show our love, right? Those are important milestones, and we will creatively find other ways to celebrate them because I also am able to show my love for my family by socially distancing and by washing hands. But until I was able to really understand the emotional element of it, I realized what I was missing as a public health professional. And so I think all of the practical advice that you gave here is incredibly helpful for me because I'm able to describe things that are very specific, right? So this is how we are showing our love to you, Mom. Your grandchildren are doing this. They're doing it by not getting in the car. They're doing it by washing their hands. And as we've kind of adapted, and grown, and this has gone on. My parents understand, my kids understand, and we understand. But the opportunities I've seen for spread in our community are those that are rooted in a gesture of love and celebration, celebrating the return of a loved one from a very scary place, right? And the more we can say that celebrating this return involves this responsible caretaking of each other's health, I think the more successful this will be. So again, thank you so much for this document.
Bill, I thank you so much for that sort of personalized way to approach this. I think it's really important to take that perspective. And I'm going to try to answer the question, and I'm not 100% sure I'm going to get to what you were asking, but let me see if this is relevant, or this is really what you're getting at as well. So one of the things that I am most concerned about for families that are released, and I also work with many unaccompanied immigrant children, is their access to healthcare and their access to, as you said, up-to-date relevant information. And one of the really terrible things, I think, that has happened over the last 3 years. This has been going on for longer than 3 years, so let me acknowledge that. But I think under this administration, the fear of accessing public services such as healthcare has really changed. And I think people who are, whether they're not documented, even if they are documented and worried about their ability to move their case ahead, are really afraid to utilize or access healthcare services. The consequences of this chilling effect is very significant always, but in this particular time of a pandemic, could have very tragic results. And I recently listened to a podcast of a Mexican family where two brothers died, I think within 24 hours of each other. One brother was turned away multiple times from getting the care he needed, and another was afraid to go because he was undocumented. One was documented, one wasn't. So I say this because, first and foremost, it is so critical for people to access healthcare services when they have those symptoms. Don't wait at home. It's easy for me to say, don't be afraid, but I really want to implore everybody to make sure your families, your friends, your loved ones get the healthcare that they need. And so the next question is really how you access and where you access those healthcare services. And I would say that, you know, in some places we know are much more friendly to immigrants than others, but I would say that if you have a public hospital or a charity hospital in your community, or know of folks that have access to immigrant-friendly healthcare services, really turn to those services. There's a whole network in the United States called Federally Qualified Community Health Centers, and their mandate is to provide healthcare services regardless of ability to pay, regardless of immigrant status. They're always on a sliding scale fee, oftentimes down to zero, so you have to pay almost nothing. And it is really important to try to access those services and understand, if you're an advocate, to have that network of resources in your hands so that you can give those to families, and that families don't have to wait to get the healthcare services that they need, especially if they're COVID related.
Great. Thank you both for that. And I know we've talked specifically around what families need to do when a loved one comes home for detention. And Bill, you spoke eloquently about what compassionate care or compassionate isolation looks like when somebody does need to be in quarantine. And a lot of that borrows from what we found in Ebola as well, which I worked on. But you know, what else do we need to know about loved ones coming home? Or related to Stan's question from earlier, the risk of transferring people between facilities without adequate testing and screening. Oftentimes status is unknown. So both from a home detention standpoint or in terms of the transportation between facilities or facilities to home, what kind of considerations do people need to be aware of?
I mean, I think people need to recognize that these kinds of transfers, anytime you travel somewhere, there is an increased risk to the person and to the community, which is why, you know, our state governments instituted do not leave home requirements, some are more restrictive than others. So that definitely increases your risk. So the question is, you know, how do you do risk reduction? How do you reduce the risk of transmitting it to somebody else or getting it en route? And that means that you know, sometimes the lawyers have to demand that transfers be stopped. So there have to be lawsuits against the entities that conduct the transfers, such as ICE, to stop the transfers because they're a hazard to public health. Sometimes, if that is impossible, we need to go to one level down and think about how do we do the least harm and how do we protect the people who are being transferred. And here I'm talking about both the people who are detained and also the guards and the driver and people who are involved in the transfer. Everybody is at risk. And the question of inequity comes in, you know, does the driver have a mask and gloves and goggles, but the detainee does not? Now, how do we weigh the available resources and how they're distributed to the people involved in the transfer? So there are multiple levels. At the very basic level, which is the provision of protective equipment, provision of masks and gloves, and hand sanitizer, that needs to be there. And if it's done without, if the transfers are done without it, that is not good for public health or for individual health.
Ian, can I add one thing to what Ranit said, which is there's an interesting concept of being tested and being tested negative. Even if you're positive, it's called false negatives. And some of the tests all the tests really that we utilize are not perfect. And I think what's important for families on the outside to realize is that if someone actually tests negative before they come home for the virus, it doesn't mean that they don't have it, and that quarantine should still be put into place so that people are safe, because the test might not have picked up the virus. It might have been early on in the infection. There's problems with the testing. So people come out tested negative, but they're actually positive, and they might feel well, because we know that a large percentage of patients, of individuals who contract COVID, have no symptoms or very mild symptoms. So they think they're fine. They think they're not infected. Their test is negative, but in fact they can be. So just to be very clear that people should still maintain, you know, that isolation for 14 days, just to make sure that their symptoms don't develop, so that they don't transmit infection. Ranit, would you agree with that?
Yeah, I have one other, absolutely, Alan, I think that's absolutely correct. And that's also that what we recommend is, regardless of whether they're tested or they show symptoms, to go into quarantine upon release. But the other thing that I wanted to mention that's a little bit more of an issue with transfers is that ICE has been saying that they're what's called screening people before they put them on a bus or before they move them from one facility to the other. The problem with screening, and screening is different than testing. Screening is not a blood test. Screening is asking a series of questions. And what I have seen in the cases that I've worked on is that the ICE screening relies on what we knew 3 or 4 months ago, or 5 months ago now in January, about the disease, which is, as I mentioned before, oh, you have to have a fever and a cough and shortness of breath. And if you don't, you're good to go. But in reality, we now know that this disease manifests itself in multiple different ways. Some people have headaches, some people don't have a fever, some people have diarrhea. And so from what I've seen, ICE is not screening people for what newer symptoms, or as we have recognized them in the past few months, are very common symptoms like loss of smell, loss of taste, skin rashes, and all kinds of other things. So those screening procedures that ICE is saying, oh, we're doing that, are really insufficient and will not capture many of the potential cases.
Okay, great. Terrific. Bill, anything to add?
I think there was a question above from Susie that was touching on what I believe you, Dr. Shapiro, mentioned, the chilling effect of folks wanting to avoid or worrying about treatment. And again, for the community advocates, and I think also for both the lawyers and physicians on the call, and Dr. Mishori's framing of risk reduction, I'd say, is actually what's going on in people's heads outside. And what we see is people are scared of reporting because they're getting tested, because they're worried about the government and they're worried about deportation. And they're also worried about their employer being told. So in reducing the risk, they're thinking that deportation is the worst, unemployment is the second worst, and maybe COVID is superior, is better than those other two. And I say that because these are really the reasons that we need to have our information and our facts straight, right? And for those who are doing advocacy, I would certainly say call your health department, ask them what the procedures are, ask them who will be informed. And for those of us who have been working with the health department, we know that they're not sharing medical records with ICE, and often communities can be reminded of that. But these are the kind of real life balances that we need to figure out how to explain when we're giving this type of information.
Very good. Thank you for that. We have a question from Hannah online, and I think we're going to touch on this in the next section, Hannah, but it's thoughts on what lawyers or clients can ask while people are in detention to give caretakers on the outside. So this is about, sort of the sharing of information, sort of across boundaries, as it were. I think we're addressing that in the second panel, unless some of the speakers have anything to mention about that, or more simply on the broader impacts of detention in the time of COVID-19, both on immigrants who are in detention, but also for undocumented, which I think is related to Susie's comment about, testing for people who are afraid of going into a hospital because of fear of being identified as somebody who's undocumented.
I think one of the issues with this disease is it's reportable and it's understood. It's understandable why it's a reportable disease. When you identify somebody in the community, you have to report them to the Department of Health because of the public health concern and how much of a big issue it is. And I think people are extremely worried that would mean that their immigration status would be disclosed as well. The other issue is also with in many locations, the drive-in. Their drive-in, things are changing as we speak, but at least early in the epidemic, there were some systems set up driving centers that were in the suburbs, which completely meant that urban communities, communities who are with a lower socioeconomic status, who may not have cars, couldn't access the testing, and that was at the time when testing was hard to get in general. So we have a situation where there's an inequity in testing, inequity in access, and of course the fear that both Bill and Alan were speaking about in accessing it, even if you have something in your neighborhood and in your area.
And I'll add one thing briefly on that, Basil, but for many states, undocumented folks still do not have licenses. So the idea about doing something that they can get detained for, to drive to something they can also get detained for, are multiple barriers. So it's positive to think, it's good to talk to your local health department about if it's a drive-through or if they can have a pop-up where folks can walk, so that those who aren't able to have licenses can also access it.
Great, terrific. Gabriela, I know you've had a couple of questions come directly to you, and why don't you pick one of those for the panelists before we move on?
Sure. So we had a question about whether there are any resources and shelters for individuals who were detained but who are later released, because right now, in light of COVID, the person who posed the question said that they're having difficulty finding placement for people regardless of whether they tested positive or negative.
I can say that there are organizations that help with housing, which is something we are also addressing in the document. I can't give you, I mean, it's different in every state and jurisdiction. So, but there are organizations who are working on housing, who are working on finding places such as hotels or other facilities that would take people for quarantine or for isolation. So I think Catherine, correct me if I'm wrong, but some of those links are in the document, right?
Yes, there are some resources. There are a number of post-release services, and I know this is a challenge when we're talking about people who don't have sponsors or family members, or maybe if sponsors are reluctant to take someone on who has tested positive. But I do think our document also, our resource also shows ways that even if someone has been tested positive, that the preparations that can be made in that accommodation to make sure that it's safe for others who are there. So I think that's something that I would highlight. But it is a challenge, and I think that's something that's coming up. Some of these challenges, maybe we don't always have the answer, but that's something we're working toward as a community. So thank you for highlighting that critical issue of housing.
I think, this is Alan, I think it raises a very important issue that we found in New York City is many families that are released oftentimes end up doubled or tripled up with other family members, and it becomes really untenable. as everyone knows, the reasons why financially and other forms of stress and just plain overcrowding. In New York City, we find that many asylum-seeking families are entering the family shelter system, and the family shelter system in New York is open to anyone, regardless of immigration status, and it does offer them access to housing. If they're families, they can enter the family shelter system, where oftentimes, really always, will have what will look like a private apartment, even if it's in a facility that shares kitchen and maybe some bathrooms. And then there's the hotel program in New York City for those who are known to have contact with COVID but can't maintain isolation. And I just wrote to one of my colleagues to see if that applies to anyone, regardless of immigration status, unless someone on the call knows that.
Thank you for that. Thank you for that response. I know it's a tricky issue with a lot of moving parts associated with it. So my last question before we move on is, and this is in part because of the majority of we have about 15% of students who signed up for this are people who signed up are students. We have faculty, we have community partners. So as we think ahead to the coming year, how can community partners, faculty, and university students all come together to advance synergies around community engaged teaching, research, and programs to support detainees and advocate for policy change? So again, what's that perfect marriage between university inclusive of faculty and students, community partners, and legal advocates? Are there models that you've seen working successfully, or is it something that the institutions on the line can actually strive for over the coming months?
I can say that there are multiple, and I think maybe this is going to be discussed later, multiple medical legal partnerships that are already operating, and certainly some that have strengthened and enhanced their activities since this crisis unfolded. And I can't stress enough how important it is to involve community-based organizations and make sure that this is where the knowledge, the questions about what needs to be done, the questions about what needs to be researched, it all comes from the community and not from the university kind of top down, but really from the bottom up. And this is, it's always a challenge across all kinds of disciplines, but I think that at least in my university, and I know that others, and I know at Physicians for Human Rights, we're making an effort to partner with community-based organizations, with people with lived experiences who can inform not only our research, but also our service provision.
Thank you. Bill and Alan, for your institutions, any evidence of community engaged learning or steps to achieve that over the coming months?
Well, I would add the National Center for Medical Legal Partnerships is an organization that really brings healthcare professionals together with legal professionals, and that even though they've focused less on immigration in the past, they're focusing more on the needs of immigrants now, and I think that's one resource that might be available. I don't know if that's exactly answering the question. The other group that I know that's bringing together healthcare providers with lawyers that are working on behalf of immigrants in detention is New York Lawyers for the Public Interest. I know some of our own providers have been writing affidavits and reviewing medical records to assist in getting adults out of family detention settings. Interestingly, the American Academy of Pediatrics has a very, very active group of pediatricians that are very active in the immigration advocacy space. Many of us are writing affidavits for children. I'll just bring up an issue. One thing that we've been seeing during COVID is that children who are unaccompanied end up in the Office of Refugee Resettlement custody shelters, which is different than the ICE detention centers. One of the issues we're seeing is delay in release, especially of kids from New York who are in the New York detention centers. And what's happening is those children are aging out. And when they age out from very child-friendly shelters to adult detention centers. And we've been very active in having to write affidavits to either prevent children from going into those centers by having them released sooner, even during this time of COVID, or for children who have been then transferred into ICE adult detention facilities, some who have had very, very serious mental health problems, to be released. And it's those children often that have very complex healthcare issues or that are the hardest oftentimes to place, especially if they can't identify a sponsor. And so American Academy of Pediatrics has worked very closely with the Office of Refugee Resettlement. We have a whole network of to connect Office of Refugee Resettlement with pediatricians to help connect them to services in the community so they can get released more quickly. The answer is a little bit more complicated than that, but if anyone's interested, I can give more information.
Great. Thanks for that, Alan. And in the interest of time, maybe Catherine, you could wrap up and begin the introduction of the next panel group.
Yes, thank you so much, everyone, for your engagement. I'm seeing we still had a few additional questions regarding testing and screening. Dr. Niyogi wanted us to remind that a positive test should always be considered, should never be considered a false positive. And we have a few other questions that maybe we can address in a follow-up email, but thank you so much to our experts. You know, this is sometimes very discouraging news, but you know, what we need to have is the facts, and then we can take action based on that. And we need our policies and our you know, everything about the way our government is operating to be impacted by, you know, the public health and evidence-based medical facts. So thank you so much for sharing those with us. And now, taking that knowledge, we'll move into the second portion of the webinar.